John. It's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And right now we're just starting to get a look at the anatomy. Your biceps tendons here on the right, and then this massive rotator cuff tear starts just to the left of the biceps, basically in this picture where my shaver is right now. So let me make sure there's nothing else to do inside the joint before we go in the subacromial space. This is rotator cuff tissue on the right here. Okay. There's some old suture material here. Hold the shaver just here. Let me get it back. Yeah, okay. And so we're going to look towards the back of the shaver. You can see some more suture material way in the back. Okay, so we got a lot of work to do. We'll just get started and see how much of this we can get repaired for you. Okay, so we've got this big tear, and you can see the old suture material here. So these old sutures. So a lot of this we're going to try and remove. This is from your old double row repair. There's the anchor. Two of them. Okay, so does anybody have anything else that might cut this? Where's the other suture anchor missing? Okay. Okay, we'll go off on the video for just a minute. Pause, please. Come here. In here, and we've got this huge tear. You can see there's some big holes in the bone from this old double row repair, and we're going to have to try and work around those. Right now we've got a spinal needle coming in the back to try and help us plan a good angle to place an anchor down. It's really not a bad shot right there. Yeah, we'll go off on the video and show you some more in a minute. Okay, we've got one anchor down in the bone. It's got 3 sutures on it. You can see the anchor here. This is our most posterior anchor. And now we're going to reach in and have a look with our crochet hook and decide what sutures we're going to use and in what order. Looks like we're going to start with the blue. We're going to go blue, black, white probably. So we'll start with the blue here. Grasper. And this is going to be a little bit of a tricky stitch, but what we're trying to do is look underneath. I need you to internally rotate as much as you can. Yeah. Thanks. Look up there, Mitzi. see we're coming through way over there. Okay, so we'll go ahead and retrieve this and use this to pass our suture. Go for it. We've got the first 3 sutures tied from the first anchor. All the stitches are right here. And that looks okay. That anchors down that posterior aspect, but as you can see, we've still got a problem. We've still got a hole, and we need to put some suture anchors in. But we've got to hold the camera. We've got to find some good places in the bone to place at least one more anchor. And based on how soft your bone is, and the fact that there's been some prior anchors in here, we've got to be real careful with the spot that we pick, because we really only have one more chance to get it. So we'll go off on the video. We'll get this opened up and cleaned up a little bit and show you what we think here. Okay, so here's another suture anchor. You can see our choices are limited. You've got a lot of damage to the bone there. We're going to try and place this down about here. Hopefully we can get that to work. Can you? Okay, that's right. Yeah, perfect. Okay. And so there's our anchor down. We'll pull on it. Feels solid. And now we'll decide what we're going to do here in just a minute. Pause, please. The second anchor in, and we've tied 2 of the sutures from the second anchor. So there's the blue and the black one. Let me take it. That gives us a total of 5 stitches tied so far. We've still got one more triple loaded anchor there. That's an old hole from an old double row anchor there, as is that over there. And so we've taken out all the old suture anchors. And now we're going to pass this last white suture from the second anchor. So we're going to get it like this. You can see we're getting it down to the bone. We just have to hope that there's enough healing potential that it heals, and that the bone's hard enough and solid enough to hold these new anchors that we're putting in. Pause, please. Okay, so we've got now 8 sutures passed and tied. As we rotate your shoulder, let me rotate the camera first. Okay, there. So as we rotate your shoulder and look, that looks like it's moving together pretty well. Okay. You can see some of the old bone tunnels, again, from the old suture anchors. Yeah, that's interesting. And we've got one more suture if we need it. This blue. See that one come? The bite. Anything else is secure, so pull it out. Done. We're going to get room shortly, okay? Good luck to you now. Bye-bye.